What is LASIK? How does it work? And is it for me? You know, LASIK surgery is a method of refractive surgery that helps us to be able to see without glasses or contacts. I mean, who would want that? About everybody in the world. You know, refractive surgery started out with what was called radial keratotomy. And radial keratotomy was great, but it destabilized the cornea quite a bit. They were using a blade, they were cutting it, and it wasn't that fantastic. They thought, well, what if we used a laser to help correct the people's vision? And so they would use some alcohol, caused a huge abrasion on the eye, and then they would use a laser, but it would take about a month for good, true healing to happen on the eye. Unfortunately, people wanted instant vision and comfortable vision. They didn't want any discomfort, and that's where LASIK was born. LASIK is the method where, to correct your vision, they go ahead and use a laser to cut the flap on the cornea, the top, microns or so, and they help lift that off, and then they use a laser to treat and reshape the eye to take care of any prescription you have. After that's done, they put the flap back down, and the next day you have pretty excellent vision. In fact, many people, when they get off the table, it's wonderful. They can see the clock, they can see many things that they didn't used to be able to see. So LASIK's fantastic. Well, how does it work? Well, yeah, we talked about how they create a flap and they use a laser. Well, times have changed quite a bit. Initially, they were using a lot of blades, and they were cutting the flap with a blade. And the blades aren't that great, and they're not as reliable as we could if we created the flap with a laser, called Intralace. Intralace is the latest lasers to be able to create and use for LASIK. And now not only do we have the laser to help create the flap, but also the laser itself can help take care of any aberrations, glares, or halos, or at least address them more so than old lasers. And so when we're looking for a wavefront laser and an Intralace to help create the flap, that's probably the best thing we want out of a LASIK system. Now, does LASIK work for everybody? Unfortunately not. There are certain prescriptions that may be prohibitive to do LASIK, where your prescription is too high, you have too much astigmatism, and a variety, maybe even the health of your eye is not very good. So what can we do? Well, there are alternatives. There are implantable contact lenses. We can also actually go back and do that PRK, which doesn't create the flap. And also sometimes we can do a clear lens exchange where we actually go in and take your lens out and put a new lens in, which is a great option. Now, I'm a little bit biased. I myself had LASIK. I love it. Is it perfect vision? No, but I don't wear my contacts, I don't wear my glasses, and I had a pretty nasty prescription to begin with. Most people see very well, see nice 20/20 afterwards. Now, surgery can cause problems. There are complications with LASIK. You want to make sure you talk to eye care providers, but in all actuality, LASIK's been around for a long time, and there are a lot of good preventative things that we can make sure that you are a candidate for LASIK surgery, and if not, what other type of surgical corrections we can do to give you that freedom from glasses and contacts. Thanks for watching. If you'd like to learn more about the different surgical techniques or things you can do to help take care of your eyes, like us on Facebook, like us on Google+, and subscribe to us on YouTube to learn more and keep up to date with your eyes.